Hi, my name is Dr. Samantha Smith. I am a physical therapist that specializes in knee replacements. I have a Facebook support group online, all dedicated to knee replacement recovery. And I asked the members of the Facebook group, what do you wish you knew prior to surgery, or what do you wish you would have done prior to surgery? And I asked them to just use like one sentence. What was the biggest thing that they wish they had known about prior to surgery? So I compiled all of those common comments and the ones that were the most popular, and I compiled them all, and I want to read them to those of you who are preparing for surgery. One of my goals with my online business, with my YouTube channel, and all of my Instagram, TikTok, things like that, is to prepare people for the surgery and let them know the truth of what a knee replacement is going to be. A lot of times when you go to your surgeon and you say, hey, I have knee arthritis, they do your x-ray, they say, okay, let's schedule a knee replacement for you. They kind of pretend like it's not a big deal. But then when you get to the recovery, you realize how much of a big deal it is. And I want people to be prepared for the surgery. It's one of the most important things you can do. Not only be educated, not only do your exercises prior to surgery, but also know what to expect. Your expectations can set you up for a successful recovery. So that's what this video is about today. So I'm going to read some comments. My computer is right in front of me here, so I'm just going to go ahead and read them off for you. So one of the first ones that was popping up in the comments on the Facebook group is people, they wanted to know how long recovery would be. They wish they had known that prior to surgery. So your recovery is going to be a full year after this surgery. You should expect 12 to 16 months for a full recovery. A lot of people in the group, I noticed they kind of comment and say, like, hey, I still have pain. It's been 4 weeks. Is that normal? Absolutely. It's definitely very normal. You should expect some sort of uncomfortableness, if that's a word, for at least 12 months post surgery. A lot of people don't know that. I don't say these things to scare anybody or to kind of sway you away from a knee replacement, because a knee replacement surgery can be such a blessing. It can really give you your life back. But your recovery, it should be progressive. You should be getting a little bit better every month. But it does take a full year to fully recovery. Another comment. I wish I knew how long the recovery was. Again, I wish I knew what I should have been doing in the early stages of recovery to ensure my success. For 8 weeks, I was doing my own thing at home because my first PT never gave me a set of exercises to do at home. So this is disappointing. Your PT should be, telling you exactly what to do. Fun fact is, PTs don't get specialized in knee replacements. I am specialized in a knee replacement because I chose that specialization, but it's not common for therapists to be specialized in knee replacement. So if you're having trouble with your exercises or anything like that, please go to my website, succeedcourses.com. I have a whole course on there for you that you can take to stay on top of your exercises, especially for this person who wasn't doing any exercises with guidance for 8 weeks. That can set you back so much. You need to be on top of your exercises from day one. So my courses can help you. Again, go to succeedcourses.com. Another comment. I wish I knew how much was up to me for my success. Prehab, which is pre-surgery, and rehab, post-surgery. And I allocated more time before and after doing it. So again, your recovery, it's going to take up a lot of your time. The first 6 weeks, it's like a full-time job dealing with a knee replacement. You're icing and elevating all the time. You are doing your exercises 3 times a day. It is a lot. Again, if you need help with your recovery, my website is the most helpful website for knee replacements. I have written all the courses. I write all my blog articles. It's not written by AI or anything like that. It's all written by me, a knee replacement expert. Another one, the pain and stiffness will last this long and I can't bend my knee. So yes, pain and stiffness is going to last for several months. It should progressively get better. The knee bending, it should come within the first 6 weeks if you're doing your rehab correctly. If you're doing too much too soon, you're not going to get that knee bend. Again, I can help you with that on my website. Another one, to prepare mentally. This is a really common topic, especially in the Facebook group. A lot of people talking about they didn't realize the mental toll this surgery would have on them. It is a tough surgery. The pain lingering for weeks and weeks, that can definitely take a mental toll, and it can, cause depression and things like that. Is this ever going to get better? Do you see the light at the end of the tunnel? All of these things are so common. That's why the knee replacement support group that I have on Facebook is so helpful. You can realize you're not alone, you're not crazy. These are all normal feelings. So please join the Facebook group if you haven't already. Just go to Facebook and search Succeed with your new knee, and you'll find the Facebook group. I wish I knew that there were so many muscles that were affected, not just the knee. I think I did a good job of preparing my home area, and I'd be in where I'd be recovering in my bathroom. I try to think of everything I'd want to have within hand's reach so I wouldn't inconvenience my husband. So yes, the knee. I guess another fun fact is you get a nice straight knee after a knee replacement. That's a good thing because we want the knee replacement to wear down evenly. You don't want a crooked knee again. But because most people have an uneven knee, that's just kind of anatomically how we are born. Our knee isn't completely straight. But after a knee replacement, you get a nice straight knee. So all the joints have to adjust to this: your ankle, your foot, your hip, your back. So you're going to have pain. And just all the surrounding joints are going to be a little bit upset that you have this new knee with this new shape. So that's normal. But a lot of people don't know that. I wish I knew not to compare my healing to others. That's a really interesting comment. We want everybody's range of motion and recovery to progress pretty equally, but you're definitely not going to have the same pain levels as other people. I've had some patients who have no pain. It's very strange. I don't know why they are like that, but some people who just need Tylenol right after the surgery for a couple of days and they're fine. Then I have the other side who they're taking opioids for several months and they just have a high level of pain. So you can't compare yourself in regards to pain. I wish I had PT before surgery. And again, I wish I knew how long the recovery was going to be. Your pre-surgery, rehab is so crucial to your success after surgery. Very, very important to get as strong as possible so you can be successful in your recovery. Again, I have plenty of things on my website to help you with that. If you don't know where to begin, I have a whole exercise class on my website. It's 6 weeks of exercises. It is dedicated to somebody who has knee pain and knee arthritis and needs a knee replacement. We focus on all the muscles that you need to be working on, stretching, things like that. And I also tell you about the surgery and the recovery process so you are educated, which is another important part to be prepared for. Another comment: I wish I had asked my doctor more questions before surgery, more details about the procedures. How do you stop the bleeding during surgery? I had no idea there was a tourniquet used. How long is the recovery? Again, that comment. He did ask if I had any other questions, but I wasn't sure at the time what I didn't know. I have a full prep guide on my website as well, and it gives you 21 questions to ask your surgeon. It's an $8 prep guide. There's so much value in this prep guide that you can use to ask your surgeon these certain questions exactly about: do you use a tourniquet? Do you use cement? Do you do a quad sparing technique? Do you use Mako robots? All of these questions you probably don't even know that you don't know to ask. What do I do if I have pain? What do I do if I need more pain medication? Who do I call? Do I use the portal? Do I call you? There's all these questions that you need to know prior to surgery to be prepared. It's all in my prep guide. It's only $8. So much value. Last question: I wish I knew the truth about the pain and the darkness of this recovery. This comment, it makes me sad to hear these types of comments, because there shouldn't be so much darkness and pain with this recovery if you're doing it correctly and if you have the proper guidance. A lot of times what's happening as these patients are going to physical therapy, and they're getting pushed and pushed and pushed, and they're ending up with more swelling and pain after surgery or after their physical therapy appointments. And that's not what you need to be doing. That's just going to cause more issues. You're going to have more pain and swelling. You're not going to be able to sleep, get in and out of your car, in and out of chairs. It causes a whole cascade of problems if you're overdoing it. If you want good guidance, again, I'm sorry for saying this so many times, but my website can be so useful for you to get on track. There should not be darkness in this surgery, in this recovery. It should give you so much hope that you can get your knee back to normal and you can live your normal life and walk without thinking about your knee pain anymore. That's what this recovery should be like. And that's what I focus on in my courses, in my exercise classes. Lots of guidance with that. So I hope this video was helpful, so you kind of get prepared for your surgery and you know what to expect. That is probably one of the most common things that people ask me, what should I do to prepare? And that is one of the things that I want to focus on as a physical therapist. That's kind of spreading the word about a knee replacement surgery. That's what I dedicate my online business to and all my social media. Again, if you don't follow me on Instagram, TikTok, please do. I have a ton of information on there for you as well. And again, my website, succeedcourses.com, super helpful to prepare for your knee replacement surgery. Thanks for watching.